Much of the world is discussing public health policy in response to battling the coronavirus. However, there is a group in India that is pushing for the end of a different public health policy, the ban on nicotine vapor technology in India. Hi there, Dom Garrett, Senior Correspondent for Vita News, here with your tobacco harm reduction update. An open letter dated March 13th was sent to several Indian Union ministers, urging them to reconsider the government's position on electronic nicotine delivery systems, or ENDS, ahead of the World Health Organization's annual Tobacco Control Summit, which is planned for this November in the Netherlands. The letter was written by the Association of Vapers India, or AVI. AVI is a consumer advocacy organization that was founded by former journalist Samat Chowdhury with the mission to defend the right of tobacco users in India to harm reduction methods. Now, this letter comes in response to an emergency order that the Indian government approved last September that prohibits the import and the sale of these products in the country. The ordinance itself was pushed through quickly with no deliberations by the members of parliament. It was later debated in Parliament 2 months later and passed despite over 60 objections and amendments proposed by opposition parties. Now, earlier in the year, the country's premier medical body, the Indian Council of Medical Research, or the ICMR, published a white paper recommending the ban, citing a study that these products are a potential gateway product to combustible cigarettes. Now, as we reported last week, the leading experts in the field are currently debating the findings of that study that was co-authored by Stanton Glantz and are currently pushing for its retraction. In the parliamentary debate, the Indian government also pointed to the lung injuries and deaths in the United States from late last year. Now, as you may know, those deaths and injuries have since been proven to be linked not to nicotine vapor technology, but instead to a thickening agent in cannabis e-liquids that were sold on the black market. India is home to an estimated 120 million people who smoke. That's about 12% of the world's smoking population, second only to China. And that includes other harmful forms of combustible tobacco like Bidis, which are cigarette-like rolls of unprocessed tobacco wrapped in leaves. Now, this leads to billions of dollars in medical expenses and over 1 million deaths per year. Now, if that's the case, why would the government take such a hardline prohibitionist stance on products that are proven to help people quit smoking? Well, there's many potential answers to that question, but one potential reason is clear: money. The Indian government owns over 25% of a conglomerate named ITC Limited. ITC Limited has many lines of business, including a chain of hotels. They sell products like food and paper and apparel, but their original business is cigarettes. It was reported that ITC Limited, whose original name was the Imperial Tobacco Company of India Limited, had $7.9 billion in revenue last year, and that over 60% of that revenue came directly from the sale of cigarettes. That means that the Indian government is directly profiteering, not only by selling these deadly products to their citizens, but also by earning millions in the taxes they make on these products, while simultaneously enacting policies that make it illegal for people to gain access to products that have been proven to help them quit these dangerous products altogether. Many countries, India included, look to the World Health Organization for guidance on policy related to cigarettes and tobacco. And AVI is hoping that this letter, along with the voices of consumers in India and all around the world, will be enough to change the stance of the WHO, who, to this point, has failed to make tobacco harm reduction a part of their suggested tobacco control policy for almost 2 decades, despite a mountain of evidence proving its impact. We will continue to follow this story as it develops, so make sure to follow along with us at vita.news on all of your platforms.